All right, I think most people are here today. Hi, welcome. My name is Natalie Metzger-Smith. I'm a technical assistance provider for TAC, and today I am helping to host the ESG-CV State Recipient Office Hours. Next slide. Just some housekeeping before we get started. We are, for the first time in this webinar series, using Zoom. I'm assuming most of you are familiar with using this platform, but wanted to let you know that after this webinar, the slide deck, the chat, and the recording and the handouts are all going to be sent out to you, as well as will be posted on the HUD website. If you can, please use the chat or question and answers. If you have any technical issues or questions at all, participant audio and video is turned off at this time. All right, so for today, we have a great group of presenters. We have, as always, Marlisa Grogan from the HUD SNAPS office. And then we have myself and Darlene Matthews representing HUD technical assistance providers. We are welcoming Chelsea Mandel and Kelly Forrestbauer from the Office of Homeless Initiatives in Colorado. They're here to talk about hazard pay. And then finally, at the end of our webinar, we're going to be hearing from Dr. Emily Mosaitis from the Centers of Disease Control and Prevention. All right, so before we get started today and jump into the agenda, which I'll review in just a moment, wanted to just run by a few announcements by you. Some of you have already maybe have heard about these, but I wanted to just bring it up again because they're very important and we're really excited. The first is that these, an archive of the ESG-CV office hours is now posted on the HUD Exchange. I have a link here so you can go to it. It's got all the recordings and the chats from each of our state webinars, which have been going on for well over a year now. So quite a lot of information now available. And then also, if you have questions about EHVs, you can now submit an AAQ to get answers. You can still submit questions to that old email address, the ehv@hud.gov, but you're probably going to get your question answered quicker if you post it in an AAQ. So just wanted to remind you to do that. And then finally, I wanted to let everyone know, I think this may have slipped through the cracks for some of you, but there is new COVID booster guidance that has been released. And we're excited about it because the booster guidance has stated that anybody 65 or older, as well as those aged 18 to 64 who live in a homeless shelter or who work in a homeless shelter, they are eligible for booster shots for COVID-19. So want to really make that known. Go back, let your subrecipients know so they can let their staff know in those ESG-CV funded or agencies that they are eligible. Next slide. So for today's agenda, we're going to start with Marlisa. She's going to provide us with a HUD waiver update, talking about which waivers expired September 30th and which waivers are expected to expire December 31st of this year. After, Darlene Matthews is going to walk us through an overview of vaccine incentives and give us an example of what other states and subrecipients are doing with regards to vaccine incentives. I'll jump in and give an overview on hazard pay and just, break down some of the basics behind hazard pay and what the HUD regulations are. And then I'm going to hand it off to Colorado, who has really done an amazing job supporting subrecipients in their efforts to implement hazard pay. So they're going to talk through how they evaluate hazard pay policies and, what to look for when, folks are submitting their vouchers and things like that. So really helpful. And finally, Dr. Emily Mositis is going to talk to us about the new CDC detection and mitigation funding that has been released. And then, as always, we'll end with a Q&A. All right, handed it off to Marlisa.
Hi, everybody. Good to be with you today. I'm going to take a couple of minutes just to run through the waivers that are in place, that are not in place, or that have expired recently. And because I know that there are a lot of them, and some of you may be confused about how to easily track which are still applicable and which have expired. But before I go to the, actually that's fine, we can stick with this slide. You're going to notice that the particular waivers that I'm flagging in this slide and the next slide do not include ESG or ESG-CV at all. And the reason for that is that all of the ESG applicable waivers are now included in the ESG-CV notice. So the ESG-CV notice, the recently released one, so that's CPD 21-08. It's a one-stop shop for all waivers that are applicable to ESG-CV funds as well as annual ESG funds used for COVID response, and those can include fiscal year 2020 and older funds. So that's the place to go, and in general, those are in effect throughout the period of performance for ESG-CV, which is right now 9/30/2022. So we're going to focus on the waivers that were recently released in the waiver memo that was issued June 30th, 2021, and I'm just flagging which ones have expired and then which ones are still in effect. So as you can see, this is the list of waivers that expired September 30th, 2021. I am using the numbering from that memo, so you can track it easily if you want to refer back to the document itself. But they include the third-party documentation of income, the initial inspection under HQS standards, the waiver of the monthly case management requirement for permanent housing, rapid rehousing, and HQS reinspection. So those are the ones that HUD has let expire. Next slide, please. And this is the list of those waivers that are still in effect and are now anticipated to expire the end of this year. So that's not to say that they could not be extended, but at this point, they are slated to expire on December 31st, 2021. And those include the suitable dwelling size and HQS standards, which I wanted to note here is not exactly December 31st, 2021, but whichever is later, the end of the initial term of the lease or occupancy agreement for a household that's covered under this waiver, or December 31st, 2021. So whichever of those two dates is later, that's when the waiver would expire. The next one is assistance available at the time of renewal. This is the ability to adjust your budget line items for your COC funded grant without it being in effect or a permanent change throughout the renewal process. So you have more flexibility in changing budget line items as needed to be able to respond to COVID. FMR, 1-year lease requirements, the limit on housing search and counseling services, the homeless definition, which extends the definition from 90 days or less of a stay in an institution to 120 days, then the permanent housing rapid rehousing limit to 24 months of rental assistance, so being able to provide assistance beyond that, and then the disability documentation flexibilities for PSH, that one is also not expected to expire until December 31st, 2021. So as always, you've probably heard this before, but if you are experiencing a particular, I don't know, I would say if a reg is of a particular hardship to your particular situation, you can contact your field office, you can submit an individual waiver request or submit an AAQ, and we really pay attention to the feedback that we're getting from you all as an indication of whether something needs to be waived in the future or if we need to extend something. So please keep your feedback coming either through your TA provider, field office, or AAQ, and we will do our best to be responsive to just what we're hearing from you. And with that, I'm going to turn it back to you, Natalie.
Thanks, Marlisa. We did receive one question. It was, does the new ESG-CV notice also include the homeless definition for temporary stays in institution of 90 days or less waiver? Yes, it does.
That's included. So it's extended to 120 days for ESG-CV and annual ESG funds used for COVID response. The one waiver that is not in its entirety included in the notice, but just referenced, is what we call the rapid rehousing to rapid rehousing waiver that was issued. It's CPD 21-05, and that is the one that gives you flexibility to shift between other sources of funding for rapid rehousing to ESG-CV funded rapid rehousing. So you can it's still referenced in the notice itself, but it's just not, we didn't copy and paste the entire notice into the ESG-CV notice. So it's just there by reference, but that one that you're asking about is in the notice.
Awesome. Thank you so much. All right, let's move on to vaccine incentives. I'm going to turn it over to Darlene Matthews.
Thank you, Natalie. It's great to be here with you all again to share some of the learnings that our disaster team has been picking up while we have been in the field in many communities across the country. So I'm going to begin the presentation by talking a little bit about outreach. Based on some preliminary data we have received, we know that vaccination rates for people experiencing homelessness are lagging behind the general population across the country. We also know that people experiencing homelessness tend to be sicker, to have a lot of co-occurring conditions, and who also lack access to services and healthcare. So when our folks get sick, they get very sick. And so the best protection against severe illness and death for COVID-19 is getting shots in arms, is making sure that our population is receiving all of the information that they can to make informed decisions about obtaining the vaccine. So today I'm going to talk about the kinds of communication that are resonating with people experiencing homelessness, the kind of messaging that seems to resonate, how incentives could be used in thoughtful and considerate ways, and how on-site events could be structured. Can we go to the next slide, please? So at this point in the pandemic, across our country, vaccine supply does not seem to be an issue. But what we are still very much finding is significant reluctance to be vaccinated. So your federally qualified health centers, your healthcare partners that may come in offering vaccination can't take a passive approach to engagement. What we are seeing is that longer engagements, engaging individuals on a one-on-one basis, using proven evidence-based strategies like motivational interviewing really will make a difference in helping a person fully consider and make an informed choice to be vaccinated. And one of the great key essential indicators in making sure that these sort of techniques are incorporated into your vaccination planning approach is funding vaccine ambassadors. This role is really critical, dedicating folks trusted individuals in a community to be able to go into shelters, to go into unsheltered situations, and really have these conversations with people experiencing homelessness. We found across the country that people with lived experience are great vaccine ambassadors. And states have played a pivotal role in being able to fund this intervention. The other thing that we have found is perhaps changing and modifying and expanding our approach to offering the vaccine. So instead of having our healthcare partners come in with just a focus on a COVID vaccine, coming in and offering broader healthcare support. So coming in with a strategy that not only offers COVID-19 vaccinations, but perhaps tetanus shots, flu vaccines, HIV testing, blood pressure testing. We have found that these are great ways to begin engaging folks in the vaccination conversation as well. Can we go to the next slide? So another fantastic activity that we are showing really works is vaccine incentives. Again, another eligible ESG-CV activity, and state contributions towards vaccine incentives have really been able to provide a really necessary engagement tool to help people make this informed decision. I personally have witnessed people experiencing homelessness contemplating this issue and really seeing the incentive being a real motivational factor. Vaccine incentives have been a tool across the country. ESG-CV funds can be used to pay for incentives at $50 per dose. For Pfizer and Moderna, because it is a 2-dose regimen, an individual can get up to $100 in vaccine incentives funded through ESG. Boosters, if applicable, which, as Natalie informed us at the beginning of the presentation, are applicable for vaccine incentives as well. Can we go to the next slide? So I want to talk a little bit about the vaccine incentives that we're seeing across the country. When choosing an incentive, it's really important for a community to consider what are some of the priority activities or places that people experiencing homelessness like to go. In Louisiana, Walmart gift cards were really popular all across the state. Wisconsin used US Bank gift cards. New York offered cash and subway fare. Baltimore used Visa gift cards, and Salt Lake actually gave participants a variety of options. So stores that they could go to or food choices. In Detroit, which is not mentioned on the slide though, one of the interesting things that they did was they paired ESG-CV vaccine incentives at the $50 mark. But then they also used private funding and gave folks that were willing to engage in conversations about the vaccine, engage in sessions that informed folks about the benefits, a $20 gift card, and that was privately funded. So just coming in and even taking the time to learn about it, using a $20 gift card was a really popular engagement tool for them. And then I want to talk, if we could go to the next slide, about, again, the important role a state can play in expanding coverage for COVID vaccines for people experiencing homelessness. States can be such a critical partner in this. The state of Louisiana was really monitoring vaccination rates across their state, and the ESG recipient was concerned. Not only was the vaccination rate for the overall population really low, but the vaccination rate for people experiencing homelessness was really dismal. And when they looked outside of urban areas, they found almost no vaccination coverage. And so the state used ESG-CV funds to partner with a federally qualified health center that also happened to be an ESG recipient. And what that federally qualified health center did was design a program to get the vaccine out to shelters and to unsheltered locations using federally qualified health centers across the state. And so this is actually an engagement strategy that is being planned and implemented primarily in rural areas. And one of the first engagement strategies that they used was they went to disaster shelters. Louisiana has just experienced a pretty severe hurricane, Hurricane Ida. There were a lot of people experiencing homelessness at those disaster shelters. And the first place that they went was actually there to offer vaccines to people experiencing homelessness. And they even vaccinated people who were not homeless, who were just interested in being vaccinated. They employed vaccine ambassadors, and they employed multiple people to be able to go out and have individual conversations with folks to really try to understand what were the reasons that folks were hesitant and what it would take to help them make an informed, positive choice for the vaccine. And one of the pieces of feedback that we got was it was actually really helpful for the healthcare providers to have those ambassadors, because it really let the healthcare providers focus on delivering healthcare. They went out with the vaccine incentives, and they again used this approach of coming into a site offering healthcare. They offered tetanus shots, they offered rapid COVID tests, they actually offered telehealth services. So if you weren't engaged in telehealth medicine, you were able to sign up for telehealth on site. The next time they're going out, they're offering blood pressure screenings and HIV testing and the flu shot. And one of the benefits of this sort of overall healthcare approach is it's really beneficial to the FQHC as well, because they can offer a variety of billable health-related services, not just the vaccine. The other really simple thing that they did was they offered multiple engagement strategies. So a way of starting the conversation. Food is a really great engagement strategy. Coming in and offering lunch. We went in before Halloween, we had offered candy, offering games and activities are just great ways to engage people in conversation and to begin talking about the benefits of the vaccine. The other thing that we really saw that was critical is frequent engagement. So the first time that you go out and you have a motivational interview and conversation with someone, you may not get them to a yes at that moment. But if you keep going back, you commit to coming back at regular intervals and establishing a relationship, that really tends to, pardon the pun, move the needle for our population. So we have just found when states engage in the vaccination effort, start funding some of these critical strategies like ambassadors, like incentives, it really does help local communities improve their vaccination rates for our population. Some of the products that we've heard that could be really helpful to communities are really helping with the onboarding of vaccine ambassadors. So training folks, once you've hired people with lived experience, really being able to train them and sort of what do you do to help have these conversations and to engage people around this effort. So one of the things that our team is going to be coming out with, hopefully by next month, are some videos that communities can use to begin training vaccine ambassadors in the field. And we'll make sure to share that information with Natalie so it can be shared directly with you when it becomes available. So thank you so much for your time, and we're happy to answer any questions.
Thanks, Darlene. We did receive one question. Marlisa, can you speak to gift cards as far as like what documentation is required?
Yes. So the ESG-CV notice doesn't specifically address the documentation, the exact documentation requirements, but there is a requirement that gift cards only be provided to people experiencing homelessness. So you would want to link or document their eligibility, that in other words, they meet category 1, 2, 3, or 4 of the homeless definition. So that would be one thing. You would also want to document that the actual incentive was limited to the $50 maximum per shot. So you could do 2 shots, $50 each. You could also pay for a booster, but you'd want to document that it's a maximum of $50 and only per shot. The other thing is that it can't be retroactive, so you'd want to show that you're giving the incentive at the time that the shot was given. So it's not like someone got their vaccine 2 weeks ago and then you're providing the incentive like 2 weeks later for a vaccine that was given like a month ago. So you don't have to be, so exact that you've got a timestamp, but some documentation and case notes or along with your other documentation saying that the incentive was given at the time of the vaccine. And then the other really important documentation piece is to identify that there weren't other incentive sources available within the community. That doesn't mean that your community, like if you're in a county and the county has an incentive program just county-wide, but that the incentive isn't necessarily an incentive for someone experiencing homelessness, namely like if you can make the case that $50 is going to incentivize someone a lot more effectively than like some other incentive, which could be like a t-shirt or maybe like a sweepstakes to go on a vacation somewhere. Just because an incentive exists doesn't mean that it's necessarily an effective incentive for the client that you're working with. So documenting that as well is an important piece. The one other thing I just wanted to quickly add is that a question we've gotten relates to the fee, the service fee that's often required or that gets triggered when you're using like a Visa gift card, for example. You don't have to reduce, like if it's a $5 service charge for that card, you don't have to reduce the overall incentive that goes to the client. So you don't have to limit the incentive to $45 to account for that $5 service fee. You can consider that an overhead cost. So you're still giving the client the full $50. So that would be something else if you want to factor that in to document that we're considering the $5 service charge and overhead cost, and that the clients themselves are still only receiving the $50. So those are the major documentation requirements.
Thanks, Marlisa. One last question, and we'll have to move on. But someone asked if an agency has to have in their budget funded a specific component, such as street outreach, in order to administer the vaccine incentives. It's not only for the street outreach component, right? It's for all 4 components of ESG-CV, as long as you're serving people experiencing homelessness, right?
That's right. So there are cases where you could have someone who is meeting categories 2, 3, or 4 of the homeless definition and being served under the homelessness prevention component. That would be also an eligible use of vaccine incentives. So in IDIS, when you're budgeting out your activities, it's a very, very high level, so you're not going to be able to account for a specific vaccine incentive budget line item. It would be great if you could make mention of that in your activity description in IDIS, but the level of detail really kicks in when you are reporting out in Sage for your quarterly performance reports. That has its own budget line item, so you do need to account for vaccine incentives as a specific cost. So that you can report your expenditures on the QPR.
Great.
Natalie, I just want to say something really quickly around documenting vaccine incentives. It can be very simple. And when we went out to shelters in Louisiana, it was simply a table. We documented the location that we were going to. We had a literally homeless category that someone could check off because we knew where we were. Everyone was literally homeless. We had them sign for the incentives. We documented which card we were giving them and the date, right? So it can be simple as putting everything on a table, a simple 1-page table.
Excellent. Thank you for that. All right, let's move on. We'll talk about hazard pay. Next slide. All right, so I wanted to provide an overview of hazard pay before we have Colorado talk about their experience managing subrecipients who are administering hazard pay. So as most of you probably know, hazard pay was allowed by HUD in the notice that came out earlier this year. It is now an eligible cost for those who are carrying out ESG and ESG-CV activities. You know, hazard pay is very important, obviously, because we are in a pandemic. I think by offering hazard pay, it really acknowledges the dangerous risks that our staff are in when providing services during the pandemic. It also is an effective tool to recruit and retain staff, which is, as most of us know, pretty difficult to do right now. Hiring is hard, so not only can hazard pay acknowledge the risks that we are putting staff through, but it's also a tool that we can use to recruit and retain staff. Next slide. So ESG-CV funds can be used to provide hazard pay, not only for new staff, but also for existing staff who are providing direct services to program participants. And this can include not just your street outreach and emergency shelter staff, but also other folks that are providing direct service. So that could include anybody from your counselors to your maintenance staff, kitchen staff, housing navigators, security, anyone who's working with the public and in proximity to people are eligible. And what many people don't know is that your staff do not have to be funded, their salaries don't have to be paid for with ESG-CV in order to be eligible to receive hazard pay, which is really great. Next slide. So no matter what you do, you can administer hazard pay multiple ways. You can add it to an employee's base pay. You can give it as a one-time bonus. But no matter what route you go, you have to have a policy about the hazard pay in your written standards, which outline the amount, the length of time you're doing it, how you determine who receives it, etc. And some of the record keeping requirements, you know, are essentially like, for example, timesheets, right? By administering the hazard pay, you can record that in a timesheet so you can track what employees are receiving the hazard pay, and it clearly states when the hazard pay began and ended. And this also should be backed up by things like job descriptions. Descriptions are great because they provide proof that that person's role is to provide direct services, and that makes sure also that the job description is included in your policy and that the record keeping you're doing matches your policy. So for example, in your hazard pay policy, you would list the job titles of the staff who are eligible for hazard pay, and then make sure that in the job descriptions, it matches that, yes, these folks are working on the front line. And so you can just directly tie that back. And then also it's really important to point out that this all should be included in your written compensation policies. It is considered a fringe benefit, and make sure that you update your workers' compensation policies before you implement hazard pay. It shouldn't happen the other way around. Next slide, please. All right, so as I said before, when you're doing your written standards and developing your policy, there are elements of what needs to be included. And that includes the amount that you're providing, the length of time, who is eligible, how this is determined, and the record keeping procedures that you're implementing. After this webinar, I'm going to send out some handouts with a copy of the PowerPoint, and the handouts are examples of hazard pay policies that are being implemented across the country. So you can see it's actually a lot of different ways you can do this, as I'm sure you're not surprised. So you'll see a variety of different ways on how this is being implemented. And then, also important that the hazard pay must be reasonable and equitable. With regard to being reasonable, a lot of how that can be tied to is, doing research on how hazard pay is being implemented, maybe in other agencies or like in hospitals for staff. Also making sure that it's equitable. And what I mean by that is that and we call it parity sometimes, but we want to make sure that, for example, if you're providing hazard pay to all of your case management staff who are administering your rapid rehousing program, that you want to make sure that your case management staff for your other, say housing programs that you're serving also have the same hazard pay. So it's providing the same percentage or amount of hazard pay funding to all people who are working in similar activities in the same programs. So just making sure that it's equitable. And then that's just a basic overview. When I'm referring to the written compensation policies, I believe, and correct me if I'm wrong, Erica or Marlisa, but when I'm talking about like the written compensation policies, usually those are separate from the subgrantee written standards. Usually in the written standards, we don't require that you provide written compensation policies. Usually those are embedded in your overall agency policies. And then someone asked, can hazard pay be used to pay any direct service employee regardless of their normal salary fund source? And the answer to that is yes. All right. Why don't we move on to Colorado? Colorado, they are here to talk to us about how they are implementing hazard pay across the state.
Thanks, Natalie. Hi, everyone. Excited to be here. My name's Chelsea, and I am with the State of Colorado's Office of Homeless Initiatives. We have Kelly Forsbauer on the line as well. She also works within the office, and we both work really closely with the ESG program. So I'm going to give a bit of an overview of how we think about hazard pay with our subrecipients, and then Kelly and I will both be available if we have time to dig into questions. We can go to the next slide, Laura. Thank you. So just a quick overview. We have just 19 organizations that are using ESG-CV for hazard pay. About half of those had planned to use hazard pay pretty early on, and then about half of those started using hazard pay midway through their grant agreement as a way of restructuring or adjusting some of their policies and their plans. Like Natalie said, a lot of the reasoning for that was to figure out how they could recognize and retain staff, and then in some cases, recruit staff as well. And then you'll see in the chart, the majority of our folks are using hazard pay within the emergency shelter component, but we do have folks that are using it within other components as well. So one thing that we've been asked is, how do subrecipients hear about hazard pay? And I won't dig into all of these bullets because they really just come down to being very intentional and consistent about sharing information about the ESG-CV notice and the specific activities that are available through that notice. But I do want to highlight two bullets here. So the first bullet is that we have built hazard pay into these pay request cover sheet examples that we've created. We do require folks to track their budgets. Like Marlisa said earlier, obviously we need to understand those as the recipient, and then we need to be able to report on those. And so we created an ESG toolbox that is primarily focused on pay requests. And there are cover sheets in that toolbox that list every single eligible item or category activity, I should say. And so hazard pay is obviously one of those items listed in that toolbox, really as a way to get folks familiar with or in the habit of thinking about breaking out their budgets and needing to be really specific about tracking hazard pay. The other bullet I wanted to flag was grant manager discussions with subrecipients. So obviously we are not alone in this, but we are seeing so much staff turnover with our partners, so many concerns for staff safety, some spend down discussions, and we're really trying to leverage hazard pay and the other opportunities available in the notice as opportunities to address some of those challenges. And Laura, we can move to the next slide. Thank you. So for us, as the recipient, we use payment requests as our primary tool to dig into hazard pay. We are really clear with folks from the beginning that we expect them to track hazard pay and then keep our grant managers in the loop on if they're engaging in that activity. So we tell everybody that if they are going to request hazard pay as part of their reimbursement request, they need to include a copy of their written hazard pay policy with that request. We present it as an expectation, I would say, rather than a question. So again, saying, can you please send us that hazard pay policy? We need to have that on file to process your reimbursement. And then as the grant manager, we review that policy to ensure that it aligns with the requirements. So again, a lot of what Natalie laid out, we specifically think a lot about exposure, making sure that the methodology is based on exposure, making sure that it is for folks that are working directly to prevent, prepare for, or respond to coronavirus. And then that gives us an opportunity to dig in further if there are any questions that come up or anything that's unclear with the policy. And then we use that policy when we are processing our pay requests. And so as a state, our general rule for processing pay requests is we look for proof of service or cost incurred, and we look for proof of payment. And typically for staff, that means an ESG activity timesheet and the corresponding pay stub or payroll summary. And so when hazard pay is involved, we are also looking at that policy and making sure that that matches up with the other documentation. And so we'll tell folks it needs to be really clear to any outside third party what exactly is happening with this hazard pay. And so if we see that staff receive, that case managers receive, $1 per hour, we see on their timesheet that they did 5 case management or hazardous hours, it is logical to us as the reviewer that they have $5 extra flagged as that hazard pay on their timesheet or on their proof of payment. And that leads us to a couple of general themes and considerations that we're seeing. So the first one is encouraging folks to really think through how their documentation and their hazard pay policy connect to each other. Because like Natalie said, the documentation needs to match up to the policy. And so if folks are saying that everyone will receive hazard pay at the end of their pay period with their paycheck, we would expect to see that in the documentation. And that doesn't always happen, right? So sometimes we'll see it come in at a different time, come in through a different vehicle. And that would raise some concerns for us because we need that consistency. But we also encourage them to think about it because it affects them and their day-to-day and how they're tracking things and how they're expected to report on things. Something else that we learned kind of the hard way, I will say, is hazard pay versus general salary increases. So we have received a couple of policies. Early on, we received some policies and we read them and thought, okay, this doesn't seem like hazard pay. This seems like folks just got a salary, got a raise. Obviously, those are two different things. And so we try to talk with folks up front. Just because you might be offering raises to your staff, generally speaking, does not mean that that is hazard pay for this hazardous work and exposure. And so we want to make sure that people are thinking about it appropriately. The other thing that you'll see when Natalie sends out some examples is just that all of the policies are different. A lot of differences with the actual amounts, a lot of differences with who exactly is eligible. So we as a state are not very prescriptive, other than, of course, ensuring that folks are meeting those requirements and the information in the notice. We always send folks the language in the notice, send them information from Part 200 about reasonableness and all of that. But we're trying as much as possible to cite the regulations and the notice to ensure that our subrecipients are equipped with that information. And then we can go to the next slide. So I won't talk through all of these, but just wanted to share again, just to illustrate how different hazard pay is for people. Some people call it hazard pay, some people call it hero pay or bonuses. Again, they're all different. And so we try to share this information with partners who are thinking about hazard pay, but it always looks different based on the organization and the staff and what their processes and practices are. And that's all we have. Again, if we have time at the end, we'd love to dig into some specific examples or talk through it if that would be helpful for folks.
Awesome. Thank you so much, Chelsea. That was really, really helpful. Lots of good information to digest. Yeah, let's jump over to Dr. Mositis, and then hopefully there'll be a few minutes at the end to answer any questions that folks have. If not, I will send out email for Chelsea and Kelly so you can contact them directly if you have any questions. Dr. Mositis, you're up.
Sure. Thank you guys so much. I'm so glad to be talking with you all. So I'm going to just sort of an alert or an FYI of some funding that is going to health departments for testing and mitigation of COVID-19 at homeless service sites and other congregate living facilities. So next slide. So as you all are probably pretty well aware, community transmission, this is from yesterday, is still pretty high across the board in the United States, but it is coming down. So we would expect that there is still going to be a risk of outbreaks and a risk of disease to individuals because of this level of transmission. So that means that, next slide, that our COVID-19 prevention considerations still need to be in place. So the top of this list is frequent testing. Frequent testing is really important in homeless service sites because of other risks involved there, namely that it's a congregate site with high turnover. So frequent testing is very important. Also, as you all are very well aware, decompression is a key cornerstone mitigation measure, using alternative spaces for quarantine and isolation, using contact tracing that's based on locations, provision of prevention resources to the people that are served, supporting behavioral health needs, and of course, connecting people to housing. So next slide. The purpose of this award is to support essentially all of that work. And it's going through the health departments, so 64 jurisdictions, so that's states, some large cities, and territories, through the CDC epidemiology and laboratory capacity building program, which is a mechanism that we use here to provide funding directly to health departments. The awards are individually based on the number of people experiencing homelessness in the jurisdiction, divided by the total number of people experiencing homelessness in the United States. So they're scaled in that way. Next slide. There are two required activities of the award. One is to facilitate coordination of testing and mitigation. And so that would be to have a designated coordinator at the health department who can help with resources, developing strategies, and supporting the relationships that have been built throughout the COVID-19 pandemic between health departments, homeless service sites, and healthcare providers and others. And then the second required activity is to implement regular COVID-19 screening and diagnostic testing for homeless service site clients, staff, people experiencing unsheltered homelessness, and then outreach staff for people experiencing unsheltered homelessness. Next slide. There are a number of optional activities. These really fall more into the realm of the mitigation area. So it's a very testing focused award, but these are kind of some of the mitigation areas. There's also this allowance to use funding for for congregate sites that are not homelessness specific. So this is to open it up if there's, living situations and congregate living situations that are not necessarily for people experiencing homelessness, but might not be covered by other funding for testing. For example, group homes or other similar situations. So a lot of these activities are, to bolster the prevention measures that I mentioned. So formalizing partnerships is a big focus, making sure that data collection is strengthened to have indicators on what is going on among people experiencing homelessness, sharing data between organizations, supporting distancing and decompression, supporting infection control, sanitation in encampments, purchasing additional supplies for cleaning and sanitizing, responding to outbreaks, improving preparedness and response, coordinating preparedness and response across health departments, and then supporting communication and outreach. Next slide. There is more information about this in guidance that went to the recipients that is publicly available. So if you have any questions, we can share that guidance. In particular, this work is really as kind of evidenced by the required activity. This is about supporting partnerships between health departments and COCs, healthcare, and others. That's a huge priority. And then finally, we're excited to be working with our HUD partners to be providing technical assistance on the award. So looking forward to that as well. And I went through that very quickly, so I'd be happy to answer any questions or clarify anything.
Thanks. One question did pop up. Is it public where our state recipients can go? Like, is there a website where they can see what health departments have been funded with this?
That's a great question. So I don't think there is a public website for this, but your state health department would have gotten it. So that's number one place to check in with. And there are some major metropolitan areas that also would have gotten it. So first place to probably check in with would be the state.
Great, that makes sense. Any other questions for Dr. Mositis? We're gonna, as she said, we're gonna learn a lot more about this funding when technical assistance begins rolling out here. All right, thank you so much. We have a couple minutes, and so I do want to, there are some resources there, but we have a couple minutes. So if anyone has any additional questions, especially about hazard pay and all the good information that we got from Colorado, does anyone have any follow-ups that they want to ask? There's a lot to digest. All right, next slide, please. So our next ESG-CV office hours are going to be scheduled for November 18th. That is the week before Thanksgiving. It is going to be an expanded time. So instead of a 1-hour training, it's going to be a 2-hour training. And that is because we're going to cover the big fun topic of financial management. Our partners from Corporate Facts are going to be presenting, and within the financial management curriculum, they're going to be talking about like voucher related processing, like how to streamline your voucher process. They're going to be talking about various aspects of record keeping, compliance, and monitoring. We did send a calendar invite out, but please forward on to the relevant staff who would benefit from this. It may be your finance staff or your grant management staff. Make sure we get those right folks in the room. Oh, one question that we got from Erica for Colorado. She asked, how did Colorado handle reimbursement requests if a subrecipient's policies for hazard pay did not meet the threshold or appropriate standards? How did you follow up?
That's a great question, Erica. And Kelly, feel free to chime in, of course. Again, we have been really clear with folks from the very beginning that that is an expectation or a requirement with that first request. And so we would not process the hazard pay payment part of the request until we could get that sorted out with folks. And so we did, of course, we want to get people paid. That's the goal. And so we tried to dig in as quickly as possible. But we would reach out to folks, let them know we're trying to work through what exactly this means and get some clarification, and that we would need that before we could move forward with making that payment.
Fantastic. Thank you. Any other questions? All right. Well, thank you everybody for your time today. I hope you found this office hours productive and informative. I will be following up with a copy of the PowerPoint and handouts and a recording, so be on the lookout for that, and enjoy the rest of your week.
Thanks.
Thank you.